It is 2 in the morning. 3 kittens are down and the queen is resting between them. She looks calm. You look calm. The room is quiet. And that quiet is the thing most breeders read wrong. There are 2 kinds of quiet in a queening. One is a queen resting between contractions. That is normal. The other is a labor that has quietly stalled, with kittens still inside, while the room relaxes from across a dark room at 2 in the morning. Those 2 look almost the same. The difference is not something you feel. It is something you time. I'm Dr. Emmanuel Fontaine, and I have spent 20 years working in feline and canine reproduction. I want to give you one thing in this video. A simple way to tell a normal queening from one that has crossed the line into trouble. By the end, you will be able to look at a queening and place it in one of 2 boxes. This is normal. Keep watching. Or this has crossed the line. Make the call. A quick note before we start. This is educational and every queen is different. So build your real plan with a veterinarian who knows your cats. And keep one split clear the whole way through. Your job at the box is to observe, to time, and to transport. The imaging and the medicine belong to your vet. That line is the whole framework. You cannot spot a labor going off track until you know what a normal one looks like. Queening moves through 3 stages. Stage 1 is preparation. Her hormones shift. The cervix begins to open, and contractions start inside the uterus. You cannot see those yet. What you see is behavior. Nesting, restlessness, panting, maybe a little vomiting, a thin, clear discharge, but no visible pushing. Stage 1 can run for hours, especially in a nervous first-time queen. That slow, nothing is happening stretch is normal. It is not a red flag. Stage 2 is active labor. The water breaks. Fluid passes. And now you can see it. Abdominal pushing. Real straining. Once that starts, the first kitten is expected within an early window. Hold on to that word, window. Stage 3 is the placenta. And here is what confuses people. Stage 2 and stage 3 alternate. A kitten arrives, then it's placenta, then the queen rests, then she pushes again. That short rest between kittens is normal. A pause by itself is not the alarm. A pause that runs too long with kittens still expected. That is, one more idea, because it explains a lot of trouble. Sometimes the contractions simply stop being effective. The labor starts and then the queen runs out of drive. That is uterine inertia, and it is not the queen being lazy. It is a physical failure of the muscle. Waiting it out does not always fix it, which is exactly why the plan you make before queening matters more than anything you improvise during it. So here is the core rule. A labor that is not progressing needs imaging, not more patience. Watch for 3 patterns. Strong pushing, with no result. She is straining hard and nothing comes. That points to an obstruction. A kitten that does not fit or sits wrong. Productive labor delivers. Pushing that does not deliver needs imaging. Make the call. Weak or absent pushing once active labor has started with no progress. That points to inertia. A labor that has run out of drive will not find it again by waiting. Make the call. And the one that catches good breeders. A silence between kittens that runs too long. While you are still expecting more. This is the signal I trust most on the breeder side. And in the queen it holds even when she looks comfortable and is nursing the kittens already out. Cats have a real pattern of interrupted labor, where she pauses and seems completely fine. The problem is that a normal pause and a stalled labor look identical from the outside. Only imaging tells them apart. So a comfortable queen does not get a pass on the clock. Make the call. Now the discharge. And this is where a comparison to dogs actually earns its place. In dogs, a green-black discharge is a normal part of delivery, from a pigment called uterovedin. Cats do not produce it, so if you are waiting to see green in a queen, you will wait forever. And that wait can cost the litter. In the queen, the warning sign is different. A dark brown to black discharge before the first kitten is born. That means the placenta is separating ahead of delivery. Call now. A clear or light discharge in early labor is normal. A foul smell at any point is not. That one is always a call. If you want to go further on any of this, I will put links to more resources on the topic in the description below. So you make the call and head in. Here is what your vet is actually doing, because knowing it is what helps you call sooner. Your vet answers 2 questions in order, and both come from imaging, not from watching. First, is there fetal distress? Ultrasound answers that in real time by reading the kitten's heart rates. Strong rates mean time on the clock. A drop means they are under stress. Second, is there an obstruction? An X-ray answers that. It shows how many kittens there are, their size, their position right now, and the shape of the queen's pelvis. And position matters. A film taken earlier in pregnancy cannot tell you how a kitten will sit during labor, because they move once contractions start. The film that counts is the one taken while she is actively queening. If both answers are no, and the queen is stable, she can often be managed medically. If either answer is yes, the path shifts toward intervention, and that can mean a cesarean. This is why calling early helps. Early, your vet has options. Time to assess. Time to try medication. Time to plan a controlled cesarean instead of an emergency one. Late, those options narrow. Calling early is not overreacting. It is keeping the door open. Most of this gets easier if you set up 3 things before stage 1 ever begins. First, know her dates. Cats ovulate in response to mating, so her breeding dates give you a real due window. A queen who has gone past the back end of that window needs a vet conversation that day, not a wait and see. Second, know her risk honestly. Breed sets a baseline. Domestic short hairs and long hairs sit low. British short hairs sit noticeably higher. And Oriental, Ragdoll, Burman and Abyssinian lines also sit above baseline. Persians, despite the flat face, sit only moderate, which surprises people. But breed is only the starting point. Your cattery is its own data set. Look at this queen's own queening history, and her mother's, and her litter mates. That record will tell you more than any breed average. Third, agree the plan with your vet before she is due. This is where the exact hours and minutes belong. Not in your head at 2 in the morning. Decide together when a pause becomes a call, who covers the after hours emergency, and what to bring if you transport. 2 in the morning is not the time to invent thresholds. It is the time to follow the ones you already agreed on. And keep the lanes clear. Oxytocin, the drug that drives contractions, stays with your vet. Always. Give it when there is an undiagnosed obstruction and you can rupture the uterus. Oral calcium is different. It is something to discuss with your vet and use on their terms. Anything injectable during labor stays in the clinic. One small habit changes the whole night. Write things down. Keep a simple labor log. Start of stage 1. Start of stage 2. Every kitten, every placenta, every rest interval. Because when you call, the first questions are: when did active labor start? When did the last kitten arrive? When did she last push? With those times, the answer is obvious in seconds. Without them, you're both guessing. And read the queen, not just the clock. Alert. Responsive. Settled with her kittens. Is reassuring. Exhausted, depressed, unresponsive is not. Fever, tremors, repeated vomiting, severe pain, or a seizure are never normal and warrant an immediate call. One of those is eclampsia, a dangerous drop in blood calcium, more common in small queens nursing large litters. One species note that helps: skip the thermometer. Temperature drop trick some people use in dogs is not practical in the queen, and repeated checks stress her enough to interfere with labor. Watch her behavior, watch the discharge, watch the clock. So here is the whole thing in one breath. Productive labor delivers. Labor that strains without result or falls silent with kittens still expected is not resting, it is stalling. Your job is not to fix it. It is to catch the moment normal ends and make the call. You now know how to tell a normal queening from one that has crossed the line. The 3 patterns: the brown to black discharge that means call now, and the 2 questions your vet answers with imaging. Here is what to do before your next litter is due. Pull the record for the queen you are breeding next and write down one thing: her own mother's queening history. Did the grandam queen cleanly or not? That single note is the start of the most useful data set you will ever own: your own lines. First timers, how close was your queen's timeline to the textbook? Tell me below. If you want more videos like this one, subscribe. It is the simplest way to keep this kind of practical, science-based breeding information coming to you. And if you want to go deeper on the topic, it all connects back to my blog and my newsletter. The links are in the description. You cannot rush a labor, but you can know the moment it stops being normal. And now, you do.